Y'all for joining us this Wednesday. My name is Shaquarius Jackson. I work with the Baylor Scott and White team as a wellness advisor too. Today's webinar topic will be on the big three. We're calling it headaches, backaches, and neck pain. I think all of us today can kind of relate to one of those three topics that you guys see coming up. We will have a guest presenter today on our webinar as well. It'll be Dr. Margot Putty. She is a chiropractor, a doctor of chiropractic. She will be joining us about halfway through our session to give us some real life examples for how she treats some of these scenarios as they come up in our real life situations. I do want to give you guys a reminder that I want you to interact with us as much as possible through our presentation today. If you all want to take one quick second for me, look down at the very bottom. You'll see three chat bubbles. Those three buttons down at the bottom will give you guys the option to interact with myself, any of the presenters, or anyone in the chat. You also have the option to use that really big chat bubble there. That will give you easy access to the chat as well. We do not have any polling today in the chat, so we'll have none of that going on, but you guys do have the option to chat if you have any questions along the way. I will be taking questions during my presentation, as well as Dr. Putty. So if you guys have any questions, please ask as we're moving along. So as we're getting started today, the first thing I want to open up with is going to be the big three in spine health. So though we aren't focusing specifically on spine health today, the first thing I want to note out is the spine and the share-related origins between the neck, the back, and the head. Just briefly looking at that picture right there, one easy thing to point out is that the spine is directly correlated between the neck, the back, and the head. As we're moving throughout the presentation today, one thing I want you guys to notice that as we're talking about everything, and as Dr. Putty is sharing some of her experiences, is that everything is correlated through the spine. So as we're giving some examples, talking about some common causes, I really want you guys to kind of listen up a little bit, and to really hear out how having a really good spine health is going to help all of these three things be 100% preventable. So though we don't have this polling option here, I do want you guys to interact with me a little bit. I do have a quick question for you guys. Just kind of dropping it over in the chat as I move over to this next slide. When was the last time you guys replaced your pillow? Or how often do you think you should replace your bed pillow? But then I'll read out some options or some results that you guys kind of put in that chat over here as well. As those results are coming in, I'll read some things out, then I'll tell you guys what is the recommended option. So, neck pain and their common causes. Neck pain is a growing and common condition for everyday people. The neck supports the weight of the head. Because of that, it is more prone to risk of injuries and conditions that restrict motions. We do have four common causes of the neck pain. They're going to be muscle strain, nerve compression, injuries, and then diseases. Now, before we get to those four common causes, I'll go into this chat here. I see someone said they replaced it last year, and someone else said they get new pillows. They got new pillows in November. So I love both of those statements. So the recommended frequency that you should replace your pillows, should be every 1 to 2 years. Now, it's going to be 1 to 2 years depending on the type of pillow that you have. For something like a memory foam, you can stretch it out to 2 years, a little bit more. For something like a feather filled pillow, we probably want it a little bit more at that 1 year frequency mark. Now they say about 203 million people experience some type of neck pain over the course of their lifespan, which is why we really express that importance over getting at least that pillow replaced, because that number one reason for what most people experience being neck pain is going to be their sleeping position. Now, when it comes to muscle strains, overuse, such as having too many hours in that kind of hunched over position. I know for me personally, I work from home all day. So being in this position by the computer screen or even just texting on your smartphone, they are going to be triggers for that muscle strain when it comes to that neck position. Now, nerve compression, that's going to deal more with the herniated disc. I'll let Dr. Buddy talk about that a little bit more later on. But those are going to be when you have bone spurs and the vertebrae of the disc, when they're kind of just touching on top of each other a little bit, and when you can't really move them as much as you want to. Now injuries, we kind of know about those a little bit more. Think about getting into like a car wreck, anything like rear end auto collisions and not being able to move that neck as easily as you would like, or anything like whiplash, getting hit from the side of you. That is going to be that common cause of a list. But also certain diseases are going to be a common cause of neck pain. So such as arthritis, cancers, some of those things also cause neck pain as well. Posture is going to be that number one associated reason for neck pain. When I speak of posture, I mention it in your everyday, in kind of your everyday doings, but also as well in that sleeping position as well. So kind of the first thing I want you guys to do as we're sitting at this computer, is I want you guys to remember this posture, kind of go through this posture setup with me as you guys are sitting here for the presentation. The very first thing we want to do is while we're kind of just sitting here, make sure your shoulders in kind of that straight line position. Make sure the hips are sitting directly, and your ears are directly aligned over your shoulders as well. Now, if any of you guys are using your cell phones or your tablets, just make sure we're keeping that cell phone held straight up in front of you, with the device, and still keeping that head straight up. I know quite a few of us are used to kind of texting on our phone looking down like this, but we do want to try to make notions as much as possible, keeping that phone straight up if we're able to. Now, right after that, if we're sitting at the computer, making sure that monitor is at eye level. Some of us, we have that desk a little bit lower, maybe purchasing the stand so that our computer can be sitting up a little bit higher when that computer is at eye level for us. Now, chair position is going to also be important as well. This is going to be supporting for the hips. Make sure the knees are just slightly lower than the hips. If they are not at that level, we just want to use that lever on the side of the chair to adjust to do so. And then making sure the chairs also have armrest as well. One, just for comfortability, but two, as well, they're going to make sure that body is also in a good, healthy position. Talk about sleeping in a healthy position as well. We want to make sure we're using head and neck pillows that stay aligned with our body. Staying active also as well is going to help with that good posture position. People who don't move as much are going to be a lot more aligned in that kind of standard body position for themselves. So sleeping here, we kind of see some do's and don'ts when it comes to sleeping. So sleeping positive, sleeping on the back. We see when sleeping on the back is going to be a positive. When sleeping on your back, a pillow placed underneath the neck is going to help you maintain proper alignment and reduce the strain. One thing I want to provide about sleeping on the back as well, we already kind of talked about the pillows a little bit, but making sure you do have a comfortable and supportive pillow that is propping your neck up in that proper position. The next one here that's going to be a positive for us is going to be sleeping on our side. Now, the sleeping on our slide position, that is typically going to be when we put the pillow directly under our neck. Again, make sure we're in that proper position as well. It's going to help support that natural curve of our neck, and it is the recommended position. What they like to also recommend for some people in support of the back, is to put a pillow right in between the knees, and then on the back position, putting the pillow right behind the knees, to kind of elevate that lower back a little bit. In the very last position, so then sleeping on the stomach, we see we put an X down there. So avoiding that position, primarily because it puts a lot of strain on the neck because the neck doesn't have a supportive position there. And it forces you also to turn your head to one or the other side. So we have one of the sides that's taking a little bit more strain. Some tips when kind of choosing the pillow, making the pillow sure the pillow does have adequate support, for the natural curve of the neck. Making sure the pillow has support for the neck, and then making sure the height of the pillow as well, is typically about 3 to 4 inches above wherever the neck is. Back pain, again, all of us can relate to this in some sense somehow. Maybe not directly having an injury coming from back pain, but maybe even just waking up in the morning, with just a little bit of soreness. It is, or studies say that about 80% of people experience some type of back pain over the course span of their life. Now, back pain are their common causes. You'll see this list is very, very similar to some of the things that we saw on the list when it comes to neck pain. And as that's mentioned already, we kind of already talked about how some of the correlations of the neck pain and head pain all stem from the exact same place, which is going to be the spine. Now, back pain is going to be the leading cause of disability worldwide. This is an actual like physical wheelchair disability. This is disability where people just can't do simple things like getting up and going to work for the next day. Now, it is 100% preventable relief, and it can be achieved for people who have maybe what we call multiple back pain episodes. So this is people who are missing work because they have back pain. This is people who do physically have to sit in a wheelchair because they have back pain as well. Now, to a few of those things we already talked about, muscle strain and sprain. We already talked about that one a little bit, as well as what nerve compression look like. A few new things on this list that are going to come about from back pain. So degenerative conditions, that is going to be new, outside of what our neck pain is going to look like. A degenerative condition is going to be something such as arthritis or osteoporosis, so those things that weaken the bone a little bit more. And then our disc problems as well. Those are going to be things that can also cause some of our back pain. Now we're going to kind of move over here a little bit more to talking about back pain and our muscle strain. So how do we prevent back pain? We go back to that kind of standard acronym of RICE. So I highlighted there in red, ICE, and I'll kind of tell you why in a little bit. So the R is going to be for rest, the I is for ice, C for compression, and then E for elevation. I'll kind of let you. I see on Doctor. We have Dr. Putty here with us on camera a little bit. I can explain it for you guys, but Dr. Putty, you want to kind of let people know a little bit why we choose for ice for relieving some of that muscle pain instead of putting heat on muscles whenever they're in pain.
Yes, for sure. So I like that you did highlight it red because it does depend, right? So ice we see more often for acute cases. So for instance, if you rolled your ankle, right, we would ice it that those first 48 hours, and then after that heat would be best. But the reason for that is we want to limit the inflammation in the area. So that's the reasoning for the ice. And then later on, the reason for the heat is to increase blood flow to the area.
Awesome, cool. Thanks for providing that. For lifting, so back pain, or when it comes to lifting, that's going to be kind of one of the number one associated things. I think, especially in your experience, Dr. Putty, I would imagine, and you can tell me if I'm wrong here, most people that come in with back pain probably told you they did something a little bit crazy whenever they were lifting. In here in this diagram, I provided kind of a 1 to 8 step whenever you guys are lifting. I think a few of these most important ones I would say on this list are first going to be number one. So planning that lift ahead of time and testing the load. So we don't know how big some things are going to be when you get them off the ground. Sometimes you just go for the gun, we get it straight up. So when we're bending down there, and remember when we're getting down there with our knees, with our chest up nice and tall, seeing how heavy that load is before we get it up and not being afraid to ask for help. Another big one on there is going to be number 4, so bending with our knees, and then number 5, tightening with our stomach muscles as well. Can you provide a little bit more insight why tightening with our stomach muscles or using those ab muscles are going to be really important to some of our back health?
Yeah, for sure. So, the core and the glutes are really involved with the low back. So, any weakness in those two, you're going to compensate with one or the other. So, low back pain, a lot of times it comes from core weakness. A lot of people don't know that, but if you're not engaging your core, you're putting a lot of load on that low back.
Okay. And then keeping that back upright as well. Is there anything maybe that is not on this? This is like just kind of in pertains to lifting up a box, but maybe what about some of our gym goers? Is there anything on this outside of that's not on this list that you'd kind of reinforce to them that'd be a really good positive lifting technique?
I mean, this I would say same thing for the gym. You want to make sure you're engaging and you want to make sure you're using the proper biomechanics. One thing I will say is when you're wearing a belt, if you go to the gym and you're wearing a belt, don't depend on the belt. Definitely use it as a tool. So puff out is how I like to explain it. So push your stomach out into the belt 360 degrees. So don't rely on it because then that can also lead to injury.
Gotcha. That's really good to know. And placement as well too. I know sometimes when I'm going to the gym, I know I see sometimes people having it in the wrong spot. Can you provide a little bit of guidance of where the placement of a belt should be if people are going to the gym or they decide to put a belt on when they're working out. Or maybe I know I see people leaving from surgery sometimes. Maybe they're at home. They just left from back surgery, and they're at home and need to make sure that belt is in the right spot. How do they? What's a good like friendly tip to reminder of where that belt should be at?
So that's yeah, that's a huge thing I didn't even think about talking about. Yeah, placement is another issue. Some people have it too high where it's into the ribs. You don't want that. You want it to sit right underneath your rib cage and under above the iliac spine. So the hip where you feel on the side of your hip, you can kind of feel a bone. So that's the iliac, right? So you want to make sure it's in between those two. For females, there are belts that are smaller. There's 3-inch belts because the big ones are going to be too big for some females. But yes, placement is super important. You want to make sure it's around the core, right? Obviously, the core it's large, but you want to make sure it's in the more weaker area of the core where there's no rib cage or iliac to protect it.
Gotcha. Awesome. Thanks for providing that. Talking about headaches, so about 15% of people here experience headaches at least once a week. About 50% of people experience headaches at least once a month. And then about 5% of people every day or nearly every single day, which is what we call chronic headaches. Some common causes here. As you guys are looking at this list, one thing I want to point out are these are some just general everyday things that we can combat super, super easily when it comes to headaches. Now, one thing with headaches, most will go away on their own. Headaches are typically not a sign of something serious. Headaches are usually a sign of something underlying. Headaches are just a symptom of whatever else is going on. And usually 30 minutes is their kind of length of time. Several hours or even days is something prolonging a problem. Now, when it comes to headaches, we'll be focusing a little bit more on dehydration here, but they can also stem from sleep, stress, alcohol. A few other unmentioned things on here are going to be medications, changes in hormonal balance. Those are going to be some other things that stem from headaches as well. Um, Dr. Putty can get into it a little bit more later on. Me and her did have actually a discussion about it earlier, but headaches will also stem from some of those things that's neck and back pain, and she'll kind of give an example of it later on. So dehydration. So dehydration are one of those things that can be prevented. I like to encourage people to get in 4 to 6 ounces of water at least every hour. Now dehydration, the first thing it's going to cause is going to be that reduction in blood flow. It's actually going to constrict our blood vessels in the brain, so we're not getting as much oxygen in as we want to, which is going to be the direct reason for that headache. The next one is going to be that electrolyte imbalance. So people that are typically having to go get an IV, or you hear about people doing like the liquid IV packet, it's going to be for this direct reason. You aren't getting as much sodium and potassium in as you want to. Another quick, easy way to combat this is to even just have water with some salt in it at home, just to get some of those quick electrolytes inside of your body. The next one's going to be inflammation. So inflammation is going to be a next cause there. And then lastly, for our hormonal changes in our brain shrinking, whenever we are dehydrated, we lose a little bit of fluid inside of the brain, and so it does shrink. So what most people realize whenever they're dehydrated, most of the time your entire head doesn't hurt. It's either just the left side or just the right side. So that is a common way you can figure out if you're experiencing like a migraine headache or if it is actual dehydration. Sharing some tips on hydration. Keeping a water bottle handy. I keep mine by my desk all every single day. Fresh fruits and vegetables are going to have some hydration in it. So think about our hydrating fruits. Water, cantaloupe, melon are going to be some great options for us there. Making our water interesting by adding some fruits to it, and then trying to minimize our caffeine and alcohol intake. So we kind of put together some patient examples here, and she'll share what her treatment looks like there in a chiropractic office. I do want to add a disclaimer. Now, when you're experiencing neck, back, or head pain, all of these things may not be able to be relieved in a chiropractic office. But for the purpose of our webinar today, this is going to be the practice example that we're going to use. So we have patient number one. Patient came in with low back pain. They had been experiencing for 3 days. He said it hurts to even bend over. Can you guide us through what it looks like from A to Z as you're treating your patient?
Yeah, so we actually see a lot of low back patients. So this is pretty common. We start off with a full assessment. We do the history and take past history of this injury, or if it's a new injury, we go into past surgeries, hospitalizations, so forth, right? And then from there, we'll see if the patient is a candidate for our treatment. So we are really big on what's called dry needling. It's not acupuncture. It's a different type of treatment. It looks like acupuncture. The needles look like it, but it does go deeper. Sometimes we even go to bone. And the reason I say that is just to show how deep it does go. This actually helps block acetylcholine. It's a chemical that contracts the muscles, so it allows those muscles to relax. It's a really cool technique, and we see it a lot with low back patients. So for this patient, I would test the range of motion, see what's going on. If it's something like a strain, we would do that, right? Anything with a disc issue, say we're suspecting some type of disc issue, same thing, we would do dry needling. Now, if it's just something that is limited range of motion, we would do a little adjustment to the area, right? With treatment plans, we don't really, in our practice, we don't do a set treatment plan. It really depends case by case. So let's say this patient does have a strain. I would see this patient 3 to 4 sessions on a weekly basis and then go from there, see how they're responding. Everybody's different though, so we kind of just play by ear in that case.
How would you, in this scenario, so I kind of heard you give two different examples. How is there a quick way? And I know sometimes you do have to send like patients off to get an MRI. Is there a easy way sometimes to tell if a patient, like how would I know maybe if I'm experiencing a muscle strain or sprain compared to maybe having like a herniated disc?
So we have orthopedic tests that allow us to see with different movement what it might be. So one of the big ones that you could do at home, and again, this doesn't necessarily mean that you do have a herniated disc. It just means something's going on in the area. But I'm just going to come and kind of demonstrate it real quick. If you can't do this and bend towards the leg without pain, there's probably something deeper in there. Again, it would have to be up to the doctor to kind of assess the area, but that would be a good indicator that there's probably a little bit more going on than just a strain.
Okay. And are there any like suggested, like just for us, maybe everyday, like at home workers that you suggest for us to do, maybe while just even sitting at our desk during the day?
So for sure, get up as much as possible. So sitting for a long time is not great for our body, right? I would recommend getting up if you can, 30 minutes to 45 minutes, even if it's just standing at a desk and then sitting back down. If you can't really leave your desk, I would recommend walking around at least once every hour, because our spine does not like to be sitting at all times, right? And a lot of times we have a very uncomfortable position when we're at our desk as well. So just be mindful of that, and it should help you to reduce some of that low back pain.
Okay, awesome. All right. So looks like we have your second patient here. Patient came in with neck pain. He cannot move neck left to the left or right. Has limited mobility. And also experiencing a headache. So you can explain us to this a little bit what this looks like. And then maybe also why is the patient experiencing a headache along with their neck pain?
Yeah, so a lot of actually patients that we have that come in that have neck pain, they do have a headache. So what we've seen is that a lot of times it's that trap that does come up into it inserts up here, right? So all the trap, if it's tight, it can create a headache. So what we do is, again, we're huge with dry needling, so we'll dry needle the neck area as well as the traps, right? Because it's all connected. And a lot of times it does help reduce some of that headache with the adjustment as well, right?
Gotcha. And do when it comes to neck pain, how often are you guys usually seeing everyone with neck pain? Like is it usually like that first time they're in and out there, like are they usually like pretty mobile after that, or are they coming to see you guys a few times after as well?
So for sure, it depends on the case. But if it is something that's not as severe, like say it's not a strain, just something, just lack of range of motion, right? They do see results after one visit. But there's also cases where it takes about 2 visits, especially if it's chronic, if it's been for more than a month, it's going to take some time to take care of it. So I highly recommend, if you are having neck pain, you go to your chiropractor as soon as you start feeling that, because the later you wait, the worse it's going to get, and it's just going to take longer to get better.
Okay. And then how does the neck pain correlate over to the headache?
So that tightness of the trap, it's since it inserts in here, it does create some of that referral pain into the head. I mean, also any muscle, if it's tight, your body is going to respond by having sometimes, not always, right, a headache. So we also notice sometimes people's blood pressure goes up, which causes a headache as well, right? So pain can respond in very different ways.
Okay, good to know. And then we have your third one here. So this patient has just been experiencing a migraine for 4 days. I know we talked about hydration or dehydration a little bit, but maybe in your practice or in your office a little bit, what does some of these cases of headaches look like with having like a migraine or even like that light sensitivity?
You were right on the money, honestly. It's most of the time it's dehydration. Yeah. So we actually sell element packs here because a lot of people are not drinking enough water throughout the day. So we noticed that, you know, adding in some element or electrolyte, sorry, to your drink does help hydrate you a lot faster than it would if you're chugging a big gallon of water, right?
Yeah, for sure. How would you guys typically assess that there? Would it be me saying, like, would I come to you and say, like, hey, I've just had a headache? Like, what would the assessment on your end look like for you kind of knowing or that, like, hey, like you're dehydrated?
So we would just communicate. We like to work with the patient's PCPs. So if they're
Okay.
coming in, we'll talk to the PCP like, "Hey, how long has this been going on? Have you seen anything that's pertinent to this case?" Right. And a lot of times when we're talking to them, we find out right there. Oh yeah, I only drink half of my water bottle throughout the day, and they basically kind of tell on themselves that they're not drinking enough water.
Gotcha. Okay, gotcha. That's good to know. I know we have some kind of questions coming up here. This isn't so much of a question, but just kind of just sharing, and I just sharing this just so people have general knowledge. I know this works different from each to each chiropractic care. I know chiropractic care is like up and down when it comes to being covered over insurance sometimes. But can you share maybe for your particular practice what coverage does look like for some people, and then maybe what cost looks like for some different services for people who maybe don't have insurance?
So we actually are not, we don't work with insurance at the practice I work at. Um, so the reason for it is I honestly personally recommend going to a practice that doesn't because you're very limited when it comes to insurances, unfortunately. Of course, I'm going to be a little biased, right? But so the reason we don't is we get to spend time with our patients. So we don't have chiropractic assistants, we don't have any techs. It's just us with the patient. And so we're able to spend a full hour with them, 30 minutes, whatever the case may be. I'm able to do dry needling. I don't have to request it from the insurance. And we see that dry needling is a game changer. I recommend finding a chiropractor that does it. It helps with low back pain, with headaches, it helps with neck pain, it helps with sprained ankles, you name it. It's a great technique, and I highly recommend you find a chiropractor that does it.
Gotcha. Okay. Do you find it to be fairly affordable for people,
Yes,
even who
sorry, I
have
forgot to
to
mention
kind of
that.
navigate it? No, you're
So,
fine.
the area I live in, it is a lower cost of living, right? So,
Mm.
we are fair with that. So, I know that in Dallas, it might be a little bit different, right? For us, a new patient intake would be an hour long, and it is 185 for that visit. After that, dry needling is 75, 77 with processing fees. But yes, we kind of we match the area, right? So um, for Dallas, I want to say there are some clinics that I could recommend if I don't know if I'm able to do that. Is that okay?
Yeah, we actually have a mixed group on here. So I live in the
Okay.
Dallas area, but the whole team we service, they live like in the Temple area, the
Gotcha.
kind of
Okay.
Colleen, yeah. So
All over
kind of
the
all
place.
like West Texas, yeah, West Texas. So we have like kind of a mixed group on here. We have like a really mixed group on here actually.
Gotcha. Okay.
But yeah, but those are really good to know. And
Yes.
I mean, I have been dry needle before as well, so I've seen like kind of different ranges of cost. But I like the people to kind of know what some of their kind of options here as well when it comes to being covered. When you see people to get dry needle, do you guys also in the full assessment do with them like adjustments and everything as well?
Yes. So we'll do
Mm.
the adjustment in the first visit, and then the follow-ups, depending on the case, we'll do either dry needling or the adjustment, or we'll do both.
Okay, cool. That's good to know. As a reminder, utilizing the member resource portal, if you guys do have any questions or want to get that access to your provider for those test results, Dr. Putty did mention that they partner with some of the primary care providers about some of those different things that you guys have going on. So this is going to be a great resource for you guys to interact with when some of those different things are going on. Also, just a great general resource. I like to encourage people to keep up with some of their different appointments that are coming up, getting that annual physical done if you guys have not already. So that's always going to be my number one reminder as well. Also going over here to our last one. Thank you guys as usual for joining. Remember, we do our webinars at the top of every single month. It'll always be that first Wednesday of every single month. So we do look forward to you guys getting back to joining us once again. I see a few things down here in the chat. So Emily asked us, will the presentation be recorded? Emily, yes, this presentation is recorded. I'll actually drop a link to our landing page where all of our recorded presentations are. So Emily, if you just hang on, Emily, for just like 2 to 3 minutes, I'll drop that link in here for you, and you'll have access to it. If there are not any more questions, guys, thank you guys so much for joining, and as well as everyone on the call. If you hang on for a while, I'll drop links to that landing page for you guys. Thank you so much, Dr. Putty, for all of your information on the call today and giving us a few different techniques and what you do every single day. And thank you for your time. We appreciate it.
Thank you guys.